Today we are going to go in depth and discuss the pathway and risks involved with the long thoracic nerve. The long thoracic nerve is a branch of the brachial plexus nerve system. It branches off the supraclavicular part, to be exact, directly from the anterior rami or plexus trunks. The long thoracic nerve originates on the roots of C5, C6, and C7. So denoted on Frank here, we can find our C7. So we have our C6 and C5. And the long thoracic nerve originates right where we would exit those. So I'm going to denote that here so we can see that. Then it continues down along the transverse part of the brachial plexus. And then the long thoracic nerve runs downward, posterior to the brachial plexus, but anterior and laterally to the body. Once we get to the clavicle, the long thoracic nerve runs posterior to the brachial plexus and the clavicle. Then we continue to move inferiorly around the anterior portions of the rib into the muscles that the long thoracic nerve then innervates. It is important to note this nerve is very superficial.
In sports, a distraction injury to the long thoracic nerve can be very common. For example, if I was raising my arm to throw a football and I turned my head laterally to the opposite side of the nerve, then you would see an extension of this nerve along my body. This would cause a distraction injury. Another common injury would be a compression of the long thoracic nerve, which is very susceptible to this injury because of how superficial it is on the outside of the body. For example, prolonged use of wearing a heavy backpack like this can lead to a compression injury. As you can see, when I put this backpack on, the straps are going right along where the nerve is and ends up compressing it. This causes damage to the nerve. A compression of the nerve is the least severe type of injury to the nerve that it can have and usually leads in a full recovery, depending on the severity. When a nerve is compressed, symptoms can be seen in the action of the muscle that is innervating.
The long thoracic nerve only innervates one muscle, the serratus anterior, which we've outlined here. The serratus anterior originates on the first 9 ribs, and then it inserts on the superior angle, medial border, and inferior angle of the scapula. All of these insertion points are on the anterior portion of the scapula. The long thoracic nerve lies anterior along the lateral wall of the chest and superficial to the serratus anterior muscle, which we've shown here. Like stated before, when there is damage to the long thoracic nerve, function is lost in the muscles that the nerve innervates. In this case, it would affect the function of the serratus anterior directly. This could lead to weakness in the muscle, which can be seen in a common diagnosis of winging of the scapula. Winging of the scapula is prevented by normal function of the serratus anterior. Again, it inserts on the superior angle, the inferior angle, and the medial border, all on the anterior side of the scapula, and it would sit like that. But in the case of injury to the long thoracic nerve, the serratus anterior would become weakened or not fire at all. And the result of that, the scapula would translate medially, the inferior angle would rotate medially, and then the medial border would jut out as so, and we would see it looking like this.
We mentioned 2 ways to injure the nerve before, which would be a compression and a distraction injury. Other types of injury to the nerve would be a laceration, which is considered to be one of the worst types of injury to the long thoracic nerve. And this may never fully heal because the nerve is completely severed. The laceration to the long thoracic nerve can be commonly seen in surgery for individuals with metastatic breast tumors. The surgery related to this is risky because it is in the same region as the long thoracic nerve and can be accidentally sliced, which would result in a laceration. The laceration would affect the communication signal of the long thoracic nerve to the serratus anterior, meaning loss of the function of the muscle distal to the laceration, which is the serratus anterior. In conclusion, we have shown you the anatomical pathway of the long thoracic nerve. and how this pathway can lead to long thoracic nerve damage and how that affects the muscle function.